policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View starts right now.
Across America, live, this is Point of View.
Hi, this is Kerby Anderson. You know, each day we take on the tough issues and provide a biblical perspective to them. The topics we cover are wide-ranging: apologetics, theology, prophecy, creation and evolution, intelligent design, marriage, family, child-rearing, the millennial generation, trends in society, politics, economics, business, religious liberty, the Constitution, public policy, foreign policy, military policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View starts right now.
Across America, live, this is Point of View. And now, Kerby Anderson.
Thank you for joining us today here on Point of View. And I just might mention, as we get closer to the end of our fiscal year, which is, of course, June 30th, we really do challenge you to consider what you might do to support this ministry. You can go to our website, pointofview.net. We have in studio with us a good friend, Dr. Merrill Matthews, who is the resident scholar with the Institute for Policy Innovation. And I know many of you have very good questions and significant and maybe even troubling questions about health care insurance and about the various bills. You have one in the House, now we have one in the Senate. And so we thought it would be good just spend an entire hour really getting into this. Dr. Merrill Matthews, always great to have you on the program.
Thank you for having me back, Kerby.
When we talk about the House and Senate versions, they are very different in some ways. Obviously, they're an attempt to keep some similarity, but this new Senate Republican bill is much different and tries to fix a couple of the problems in the House, doesn't it?
It does, but though I would say not as different as we were led to expect when the House passed their bill, because the senators essentially said, well, that's dead on arrival in the Senate. They've actually sort of followed the same basic structure. They tweak how the subsidies would go. They make a few other changes. They do some things, I think, that make the bill worse. But arguably they do a few things that make it better as well. So, but it's the same basic structure with several things changed in there.
But you can't say that either of these fit what most voters thought was going to be repeal and replace, right?
I think that's absolutely right. In fact, when you go and look at the 142-page Senate version, as I tried to do the other day, I struggled with that, because instead of saying, starting out, we're going to do this with Medicaid, we're going to do this with health insurance, it says provision XYZ of the IRS code such and such is changed to say, instead of will, shall, or something like, it just goes on like that. And I think you'd have to go back to all those codes. You'd have to figure out what it says, because it's changing the language in the Affordable Care Act, in the IRS code, and some other things. And it's very difficult to sort of understand what it's trying to do in some places.
And I wonder how much of that is intentional, because I remember I guess it was Louis Gohmert, first of all, and of course Dr. Burgess and some others saying, okay, we really tried to read this, but you had to have the Federal Register, you had to have the IRS code, you had to have a variety of other things, because they would make such arcane and difficult to follow connections that nobody, even in Congress, really exactly knew what was being done, did they?
That's right. And this is done by what's called Ledge Council. Ledge Council puts these things together. It's a it's a part of Congress. The members of Congress say, this is what we want to do, and they've handed over to Ledge Council. Ledge Council writes the legislation. And then sometimes you go in and sit down with them. I've done that, to say, well, we're trying to do this, this, and this, and they'll make notes and so forth, and they'll come out with something they think achieves those goals. So you actually have professional staff doing it, but you have to be almost a professional to read some of this stuff.
Yes. Well, again, this is the Better Care Reconciliation Act of 2017. And one of the things that people said it might be able to do is help individuals that maybe are near elderly, low-income workers to not have to necessarily deal with some of the things that were in the House bill. I don't want to get too much into the weeds, but it seems to me that there are some changes that the Senate tried to make that the House never really anticipated. Fair?
Well, and one of the chief things is that it continues what the provision we called community rating.
Right.
Remember, under the Affordable Care Act, it said every health insurance policy has to be guaranteed in the individual market. An insurance company can't deny them, nor can they charge them more for a medical condition. The original version of the House version said kept both of those things of Obamacare in there, which many of us have argued over the years is what was destroying the individual health insurance market. Why we see insurance premiums going up and insurers fleeing that market. So the House maintained that. Then they had that didn't get the votes. House Freedom Caucus pushed back. They had a struggle, had a debate, had a compromise, came up with something that said we will allow states to opt out of the community rating provision, so that a state still has to, insurers still have to accept them, but a state could change that one provision, which I would argue makes the House bill maybe workable. I mean, it's hard to know, but probably workable within states that did it. The Senate kept the original Obamacare version, and as well mimic the initial House bill. So as a result, I'm not sure that the individual market survives under this as they've done. Now, they've been talking about putting in a provision which would allow, if you've been uninsured for 63 days, you would have to wait 6 months before you could get a health insurance policy, whether you're whether it's a period beforehand or during that open enrollment period that they put in there. That's meant to discourage people from dropping insurance. Will it work? I don't know. Yeah. I'm not optimistic, but sometimes these things work out better than you think.
Well, let's talk about that one for just a minute, because there are a lot of P's, and one of those is pre-existing conditions. And I've said, and again, correct me if I'm wrong, Dr. Matthews, there are two kinds of pre-existing conditions. One where my child is born with cystic fibrosis, muscular dystrophy, Down syndrome, a chronic issue. The other kind is what we saw first with Romney Care and now with Obamacare, and that is, since it's must carry, and since I can just stay out of the health insurance market until I need it, and then I jump in and they can't deny me that, this provision was an attempt to try to keep people from jumping in and jumping out, wasn't it?
Right. That's right. To your point about children, prior to Obamacare, if you had children and you had a policy, you had 30 days to enroll the children, and the children would be accepted regardless of any medical condition. Democrats tried to make it sound like you could have a child, and that child, if they had a pre-existing condition, wouldn't get insurance. Not true.
Not true.
Under the previous law. But I'd argue there's two other kinds of pre-existing conditions. One in which somebody stays out of the health insurance market, gets sick, and then decides to move in, and that's where insurance was trying to sort of stop that. But the other provision is that some people get medical conditions through no fault of their own, late onset adult diabetes or something like that. So what the Obama administration did was try to point to those people, and not those people who sometimes have major medical conditions because of living risky behavior.
Right.
And I would argue Christians and those who try to avoid risky behavior end up, in essence, subsidizing risky behavior from people who are able to game the system. So we want to help that person who ends up with adult onset diabetes, no fault of their own, versus the person who has engaged in a lot of risky behavior and now has some medical problems. You want to be careful about subsidizing that and making it too easy for them, because it, in essence, gives them an incentive to engage in the risky behavior.
Lots of great material, by the way, at the Institute for Policy Innovation. We have that link. One of the articles, Supporting Obamacare Means Never Having to Say You're Sorry, by Dr. Merrill Matthews, as well as some other great articles we've posted there for you. So, again, I encourage you to go to IPI and find out a little bit more about some of the great resources that are available. Let's take a break, and we'll come back. We'll get into some others. We only mentioned one P, and that's pre-existing conditions. What about price, portability? We've got a lot of things to cover. And Ted Cruz has suggested, well, maybe there could be an amendment that would say you don't have to have every one of the policies that have to have the 10 essential health benefits. What are those, and how does that relate? Got a lot more to cover. And again, if you'd like to know a little bit more about the Institute for Policy Innovation or Dr. Merrill Matthews, we have that link on our website, pointofview.net. Let's take a break. We'll continue our conversation with him right after these important messages.
This is Viewpoints with Kerby Anderson.
You know, more and more social commentators are starting to write and express their deep concern about what has been happening on university campuses. Bernard Goldberg recently wrote about the cowards of academia. He welcomed the summer so that we don't have to hear from those sanctimonious liberal snowflakes that have taken over college campuses and prove that the lunatics have taken over the asylum. One asylum that got his attention was Evergreen State College in Washington State. They have what is called a day of absence, in which minority students leave the campus as a symbolic gesture. This year, they demanded that the white students and faculty leave instead. And one biology professor who disagreed with the idea had 50 liberal students disrupt his class and was forced to teach his class in a local park. Bernard Goldberg was shocked to hear how the school's president responded. Did he suspend or expel members of the mob? Did he at least issue a mealy-mouthed note of disapproval? No, he did not. Other commentators have also expressed their disbelief. New York Times columnist Frank Rooney writes, "The campus inquisitions must stop." He was shocked that the Evergreen president merely said, "You know, it's just the way discourse goes these days." Editors at the Seattle Times concluded that at Evergreen State College there was no safety, no learning, no future. Columnist Fareed Zakaria, speaking at the graduation ceremonies at Bucknell University, lamented the current state of education on many American campuses. He said American universities these days seem committed to every kind of diversity except intellectual diversity. Conservative voices and views, already a besieged minority, are being silenced entirely. You know the chaos on campus is reaching new levels when many of these progressive voices are now expressing their concerns about what is happening at many American universities. I'm Kerby Anderson, and that's my point of view.
For more information about issues covered on Viewpoints, visit pointofview.net. Pointofview.net.
You're listening to Point of View, your listener-supported source for truth.
Back once again, Dr. Merrill Matthews in studio with us, and if you would like to know a little bit more, you can go to our website, pointofview.net. We've got a couple of articles by him, and we'll get into those in just a minute. But one of the other ones we mentioned was the issue of price, and in one of the articles we've posted, Dr. Matthews, you talk about supporting Obamacare means never having to say you're sorry. Outrageously high deductibles, exploding premiums, and skinnier and skinnier providing networks. Okay, Other than that, Mrs. Lincoln, how do you like the play? This is just awful. What about the issue of price? Because I think in some respects the Republicans might be able to sell this plan to the American people, at least if the premiums go down.
Right, I think that's right. And let's be clear who we're talking about. About 155 million Americans, workers, and their dependents get health insurance through their employer. The employer policies were affected by Obamacare, but not nearly as much as the individual market. Medicare and Medicaid was expanded, but at least the coverage wasn't affected very much under Obamacare. A few changes, but not much. The place where we really have the issue is where individuals want to go out and buy their own health insurance policy, as about 16 or 17 million people had done prior to Obamacare were in the individual market. This is what Obama thought was the genius of his bill, was he was going to fix this and make this a good, portable, low-price option for people. They could go in the exchanges that have lots of health insurance options. They'd be able to get competition, low prices, and so forth. And that's the genius of the bill is the one that's totally collapsing. And so that's the problem. And that problem is Obama said we're going to ignore standard actuarial principles. We're going to require health insurers to accept everybody. We're going to not let them charge more. But in order to keep people from gaming the system, we'll impose a mandate to have insurance. We'll impose a penalty if they don't. We'll limit the amount of time they can sign up during the year, 6, 8 weeks, something like that. And then we'll provide very significant subsidies for both to help low-income people, but also to say if taxpayers are paying your health insurance, why wouldn't you take it? And they did all that. We weren't optimistic that would fix the problem. And it didn't.
No, it didn't.
And they were stunned by that. And now Republicans are coming up, but Republicans have decided they like all those insurance provisions.
Oh, dear.
And so they want to bring them over. That's the part that's killing Obamacare. And yet they want to bring it over and say, we're going to lower premiums and increase access. And I'm not sure they're going to be able to do it might be in certain states under the House version. Under the Senate version, I'm less optimistic.
And again, one of the things you mentioned earlier, let's get back to that. States would have some flexibility. I'm going to get into what kind of flexibility. Under both bills. Yes, and so that was, from at least a philosophical point of view, kind of the old Ronald Reagan statement that the states could be laboratories of democracy. And there was a lot of difference in health insurance and health care delivery in, say, Delaware, which is a very small state, in Texas, which is a very large state, or the difference even between Detroit and Tupelo, Mississippi. These are striking differences. So some kind of flexibility makes some sense, doesn't it?
Some types of flexibility. And prior to Obamacare, most regular health insurance was regulated by the states. The federal government regulated some employer products, especially those larger companies that do what we call self-insure. But health insurance has typically been a state issue. Obamacare sort of moved the states out and said we're going to impose a one-size-fits-all on everyone. That hasn't worked very well. Republicans want to give states flexibility again. I suspect we would see some states do a pretty good job. I suspect some states wouldn't do such a good job. But, I don't know why a senator from New York is so darn determined to keep us in Texas from having good health insurance. If you want to keep all those provisions, fine. Keep them in New York. Destroy the market for them. Actually, they did that 2 decades ago. But let the rest of us have a chance of getting a functioning health insurance market.
What about, again, when we get back to premiums? I know when Kathleen Sebelius was the Secretary of Health and Human Services, she said, I'm going to look askance and maybe even more intently on those insurance companies that raise their premiums more than 10%. Well, the problem is ultimately becomes a death spiral, because as the price goes up, some people say, this is pretty expensive. I will risk not getting insurance, so it gets sicker and sicker and more expensive. Isn't that what's going on? And
to your point about Kathleen Sebelius, she did exactly that. She said we're going to look very closely at insurance premium companies that ask for a larger than a 10% increase or more in annual premiums. Kerby, I'm nostalgic for 10%.
I take 10%, yes.
I'd take that in a heartbeat. That's much better than the 40 or 50% that we're seeing out there. And that's how much things can change in just a few years. And you never heard HHS coming back over these other things saying, we're not going to let companies do this, because they knew their losses were just dramatic out there. So that's where we are. In the past, you could get insurance, you could get premium increases, especially got older in the individual market. but we've never seen anything like we have right now. It is bizarre, and Democrats who hated high deductible policies, who really criticized premium insurance.
And gave you a bad time, I remember one time.
Oh, absolutely.
Yeah, I remember you actually having people just go, I can't believe you're
absolutely. And I was talking about a $2,000 or $2,500 deductible total for the family.
Right.
Now you've got $7,000 per family member, per adult, and $14,000 for a family. And Democrats are defending that.
To quote you, you said, free market conservatives have long supported high deductible health insurance policies, ideally combined with health savings accounts, but we usually talked about $2,500, which today look minuscule compared to some of those. Isn't that
Man,
amazing?
I wish I could get back to a $2,500 deductible policy.
Yeah, now when you're talking about some, as you said, are routinely $6,000 or $7,000 and $14,000 for a family. This is why I have so many people, Dr. Matthews, saying, I have to pay for a policy that I know my family will never use because the deductible is so high.
And Democrats used to criticize me, saying I was in the pockets of the insurance company because I was promoting $2,500 deductibles, that they said that means people will be paying premiums and the insurance company doesn't have to pay anything. And that's where they are right now with those $7,000 or $14,000 for a family, and insurers are still losing money.
Yes, that is just amazing. Well, one other issue that relates back to price, and that is that you have in a policy have to carry what are called the 10 essential health benefits. And Senator Ted Cruz has proposed, and it's kind of interesting because I didn't know that there was also the flexibility you talked about in the states, but he's suggested that if indeed an insurance company has one that meets all 10, they would have the freedom to have some other skimpier, cheaper policies. And I know that our listeners in places like Oklahoma and Georgia said, I would just go back to this cheap policy, the one that President Obama said was a worthless policy. No, it wasn't worthless. It actually was useful to me. Junk insurance. But this is, again, the problem because one of the 10 is maternity and newborn. Another one's pediatric services. Okay, if you're 70 years of age, I don't think you're using maternity or pediatric services. What are your thoughts?
That's right. Plus drug and alcohol abuse.
Yes.
That may be an issue
mental
for
health and
mental health and other things.
Yeah.
And so, yes, they wanted to make sure that insurance was comprehensive. Comprehensive insurance is better in some ways, but it's also more expensive. Most employers covered most of those things anyway, so the employer policies didn't change that much, but in the individual policies, people oftentimes would go for insurance that didn't have all of those various things in there if they could get access to it, and that allowed people with less income, young people who said, I just got a little bit of money to spend, they could get what we called a mini med, might pay a total of $25,000 in a year out of in insurance benefits, give you generics for $10 a person, give you, say, 5 or 6 free doctor's visits a year, and a few other things like that, but it might cost them $35, $40, $50 a month for something like that, and that made it affordable, and it gave them an option. And what they did was they wanted to eliminate those because they wanted to make sure everybody had comprehensive coverage, which meant that everybody and their dog with with a product or service to sell in healthcare was in there lobbying, saying, you have to cover our stuff.
Yeah, and that's where it got out of hand. Let's take a break. We'll come back and continue our conversation with Dr. Merrill Matthews, and I hope you're learning a little bit more about how difficult it is to construct a health insurance policy for the country and why the House and Senate Republicans are still struggling with some of those issues. And if you appreciate the conversation we're having today, let me just mention we're coming to the end of our fiscal year. That's June 30th. And again, you can go to our website, pointofview.net, click on that button that says Give Now, or as we go to a break, you could actually call someone. We have a pledge line number. It's 800-347-5151, 800-347-5151. You can talk to someone and say, I'd like to pledge an amount or even like to give an amount so that I can support this ministry, and we certainly want to encourage you to do so. And as an incentive, we have some donors that have gotten together and provided a matched fund. That means your gift of $50 becomes $100. If you want to come up with a gift of $100, it becomes $200. So again, go to the website, pointofview.net, or again, you can call that pledge line number 800-347-5151. A lot more to cover with Dr. Merrill Matthews in studio. He's with the Institute for Policy Innovation. You can find that on our website, pointofview.net. We'll be right back.
There's a saying, if you fail to plan, you're planning to fail. Setting goals is something that every successful business and ministry does. Point of View is no exception, so please listen for just a minute here. This week, we're finalizing the budget for the coming year, including things that we hope to accomplish. Some plans are on the bubble right now. They're at risk. When the fiscal year ends Friday, we'll know whether we can do them or whether they'll likely have to wait. Point of View wants to bridge the great divide in America, cutting through the fake news that some are spinning and also bringing you critical information that others aren't talking about. To do all we can in the coming year, partners like you need to step up now. Visit pointofview.net, click the banner Bridge the Great Divide, or call 1-800-347-5151. Whatever you give by Friday will be doubled up to $10,000. The hours are counting down. Please invest in a bridge of truth. Pointofview.net and 800-347-5151.
Point of View will continue after this.
You are listening to Point of View. The opinions expressed on Point of View do not necessarily reflect the views of the management or staff of this station. And now, here again is Kerby Anderson.
Continue our conversation today with Dr. Merrill Matthews. Again, he is with the Institute for Policy Innovation, individual that has testified so many times in front of Congress on medical issues. Just an incredible expert, and we are privileged to have him in studio with us today. Your article in Forbes, which we've posted as well, ends with this kind of ominous statement. The risk is that premiums continue to rise and insurers flee, and Democrats, the media, and maybe even the public say Republicans' free market approach didn't work. So let's move on to a government-run single-payer health care system. I've said before, Dr. Matthews, that in some respects this is the old Pottery Barn dilemma that Republicans face. You break it, you buy it. Well, they didn't even break it. There were people that were already blaming the Republicans before they even brought about a change, right? But now the possibility is if you don't get this right, then you're going to have the Bernie Sanders people saying, this is why we need a single-payer system. We need just like Canada and need just like the United Kingdom, right?
Which Bernie Sanders has wanted for some time, which Barack Obama said was his preference, which Harry Reid said was his preference, and which Nancy Pelosi all said was her preference. So they've all said they would prefer to go to a single-payer system. So we've got a problem in that Republicans are going to get blamed for whatever happens. If they can't pass anything, they will be blamed for the collapse of Obamacare. If they pass something and it doesn't work, they will be blamed for it. And I think there's a fair chance that what they pass won't work in the individual market. And when you've been campaigning for 6 years on we're going to lower premiums and make health insurance more accessible, if that doesn't happen, it looks pretty bad. And I think that's at least a possible outcome of the legislation they're considering.
Well, again, that's some of the high-stakes politics that's taking place right now. So there's sort of a no-win situation. So maybe it's just time for some of the Republicans to say, let's just do what we need to do in the first place. If you were to have some control over this, are there some actions that aren't being taken right now by either the House or the Senate that are maybe possible ways to reduce the cost of premiums and to get to a point where people actually have an insurance policy that works for them?
Well, let me give Republicans a little bit of the benefit of the doubt here in that they're trying to operate under the reconciliation process. We've talked about that before. They can't do as much as they would like to, at least it appears that way, under the reconciliation process. So they're trying to do this with at least one, maybe both hands tied behind their back.
Very true.
in what they can do. Having said that, I think they could probably do a better job, but they don't have the votes for it. And this is something I wrote about just a few days after Donald Trump was elected, which was Republicans are going. There were several challenges Republicans are going to face. Some of which are some of the Republicans have grown to like the insurance regulations that are in Obamacare. Some of them are afraid that they might lose their seat if they change it. Some of them are afraid of what Democrats will say and the media will say. You're bad, you're hateful, you're mean, you want people to die in the street. They didn't have a plan ready. I mean, there were several elements there that said there's several red flags here about whether or not Republicans will ever actually be able to get this done.
Right.
But the plan that Paul Ryan had written out, a Better Way plan for healthcare reform, a year ago in June, the one that Tom Price had introduced in 2013 and reintroduced in 2015, were pretty good plans. And if they had gone with Tom Price's plan, I think we would be in pretty good shape. But they couldn't get all the votes for that, so they've gone back to some of the insurance regulations and some of the other things that they're trying to do just to get the votes, to cobble together the votes they need.
Well, again, that answers one of the questions that we've had so often. People say, they've had almost 7 years for this. And I try to say, well, let's give at least some credit where credit is due. Tom Price, who now is the Secretary of Health and Human Services, came out with something 4 years ago, which looked pretty good. And as you said, Paul Ryan did as well. So it's not like they just said all of a sudden, slap of the forehead, January 2017, and said, I guess we're going to have to come up with a plan here.
Well, I agree in part and disagree in part. And the reason is there were, as you point out, Republican plans. There was just no Republican plan.
That's the point.
And that's
Too
the
many
issue.
Plans. Yeah.
And so even if you gave, and Paul Ryan, as I said, came up with his outline a year ago, that sort of set the groundwork for it. But come November the 8th, Republicans should have said, well, we thought Hillary Clinton was going to win, but now we know we're going to be in charge here. They should have gotten the process going immediately. They did not. Even if you give Paul Ryan a little bit of a break, as far as I can tell, Mitch McConnell didn't do anything until the House bill passed. And then they started theirs. You've been talking about repeal and replace for 7 years, and you didn't do anything until Republicans passed the House bill, and that's when you got started on this. So I think Republican leadership is open for some fair criticism on that.
Well, and I won't disagree on that point, so that is a good one. You know, one other issue that you talk about in your piece on supporting Obamacare means never having to say you're sorry. We've already talked about high deductibles and price. But another one that I hear all the time when we open up the phones is, I can't find any doctor that will take this. In other words, as you call it, skinny and getting skinnier provider networks. And in a minute, I also want to talk about Medicaid, but let's talk about that one first. Why is it that all of a sudden I can't not only keep my insurance plan, but I can't keep my doctor? I thought somebody promised me that I could keep my doctor and my plan. But
I'm thinking they did. In fact, PolitiFact called that if I remember right, the 2013 lie of the year.
Yep.
It had a lot of competition, let me say.
Yes.
But at any rate, what's happening is insurers are increasingly narrowing the networks,
Right.
both because it discourages sicker people from coming. If you can't see your doctor, and the person who cares most about seeing their doctor is a sick person.
Right.
So if you're not typically going to the doctor and your doctors get dropped, it's less of a problem if you're not sick. So it's a backdoor way to discourage sick people from signing up for their plan.
Wow.
In addition, they're trying to negotiate lower prices. The best doctors tend not to want to do that. I don't want to criticize people who do, but I mean, if you're a doctor who can command a high price and they come up and say, we're going to give you very little for doing these procedures, you as a doctor may very well say, just not going to take that. And we've seen that time and time again. So it's a way for the insurers to get a very small group of people they can pay a very low price for. Mm-hmm. That tends to be the doctors who are not the top.
Right.
And it also tends to be the ones that the sickest people don't want to go to. So
it's a lose-lose in that regard, isn't it? There's no win-win there.
And what's happened now, United Healthcare has gone almost entirely to what we call an exclusive provider network. Right. Used to, you could go outside of your network and you had to pay a little more in the copay, a little more. You might have a higher deductible. Now, United Healthcare and I think a few others are going to exclusive provider networks. So if the doctor is not in your network, it pays nothing.
Nothing.
Absolutely nothing.
That's
now, the benefit
amazing.
of United Healthcare, it's the largest health insurer, so you have more options. But you get stuck in you go into the emergency room and none of these are United Healthcare people. You're going to be stuck with a very big bill.
That's just amazing. Another aspect of that for our listeners that are on Medicaid, they just say, I can't find a doctor that will take that. And the very obvious reason is the reimbursement rates to these doctors is so low. Explain that if you might.
That's right. Medicaid sets the price. This is for the federal state health insurance program for the poor. Medicaid sets the price for what it will pay for procedures, both for doctors and for hospitals. That's usually done at the state level with some federal oversight on there. It has been a problem for some time. Now, general practitioners, family physicians tend to be more accessible under Medicaid, but the specialists tend to be much more difficult. In fact, a former state senator in Texas who was also a doctor told me one time, this is 3 or 4 years ago, he said, used to if I had somebody coming to me, he's a family doctor, who a low-income kid, I'd say, you need to have surgery, you need to see a specialist. I'm going to call Dallas and send you there. He said, now I have to call and ask them to do me a favor to see these kids because they just won't take Medicaid anymore.
Yes. And again, the reason they're cutting it back is, again, there's no flexibility. So some of these plans would give at least the states a little more flexibility in terms of Medicaid.
That's
true?
right. And both the House and Senate bill tries to give the states a lot of flexibility under Medicaid, not so much under Medicare. Medicare tends to pay a little more, but the problem for a doctor's office is if you've got insurance paying X amount, you can only have what we call a patient load of maybe 10-15% of Medicare or Medicaid patients. Otherwise, you get too many many patients who are not paying enough, and you as a doctor can't pay your bills.
Well, we certainly understand that. Let's take a break, and we'll come back and talk about just a few other short issues. We don't have a lot of time here, but again, we are so privileged to have in studio with us today Dr. Merrill Matthews with, again, the Institute for Policy Innovation. It is an organization I would encourage you to go to their website and support their good work. And if you appreciate some of the things you're learning today about health care and health care insurance, we certainly encourage you to go to the IPI website, which we have linked on the website, and all the information we have about Dr. Merrill Matthews. Also, let me encourage you to go to our website, pointofview.net. As I've mentioned, we're coming to the end of our fiscal year. That is June 30th, and so that means that we need to hear from you. And if you've been waiting till now, no need for any more procrastination. Good time to click on the button that says Give Now on our website, pointofview.net. And, of course, as I mentioned, if you don't want to get on the computer and do that, or you'd like to talk to someone and maybe even help us with a pledge of some support, or maybe even help us with an additional match, we'll provide that as well. 800-347-5151. And as I mentioned, we do have a match fund, so that means your gift of $50 becomes $100. Any size would be greatly appreciated. We'll be right back.
Welcome to the First Liberty Briefing. I'm Jeremy Dice. $3.25 million. That's the price one New Jersey town will pay for its religious discrimination. Not long ago on this program, I told you about the refusal of Bernards Township, New Jersey, to grant a building permit to the Islamic Society of Basking Ridge, New Jersey. The society fought City Hall for at least 4 years, having their application denied 9 separate times. In November 2016, the U.S. Department of Justice filed a suit against the township, alleging a violation of the Religious Land Use and Institutionalized Persons Act. The Department of Justice won just 2 months later. But by May 2017, the township decided to give up the fight, settle with the government, and allow the Islamic Society to build their mosque. This is good news for religious liberty. Though Bernards Township, in this case, used their zoning laws to prevent the building of a mosque, it could have just as easily been a synagogue, a church, a cathedral, or other house of worship. City governments cannot intentionally throw up permitting obstacles to religious organizations. They must treat a religious organization's application for land use just like it would any other land use application. In a land that values freedom, our government should never make the free exercise of religion difficult. To learn how First Liberty is protecting religious liberty for all Americans, visit firstliberty.org.
More people today are saying Americans don't really need religion, but America does need religion. Religion helps the economy, families, and even national security. Learn more by reading Saving America, 10 Reasons Religious Freedom is the Key to Our Nation's Future. You can download this free booklet at firstliberty.org/Saving America. That's firstliberty.org/Saving America. Discover 10 ways religion benefits America at firstliberty.org/Saving America.
Now, back to Point of View, your listener-supported source for truth.
Back for a few more minutes in studio with us today, the resident scholar with the Institute for Policy Innovation, Dr. Merrill Matthews. And we've talked about some of the P's like price, and I wanted to get to portability, but another P was pharmaceuticals. And that's an important one because, again, Dr. Matthews, we have all sorts of people calling and telling us how expensive their drugs are. And then you go to various insurance plans, and some of the drugs are not in the formulary.
Right.
Explain what's going on with that.
Well, the pharmaceutical industry has changed over the last 10 to 15 years. They used to make what we call small molecules, little pills to do things. Now they're increasingly into what's called biologics. These are usually injectables. They're much more complex, much more difficult to create, but they're also addressing a lot of major medical conditions that tend to affect a fairly small number of people. It's called a orphan drug if it affects more than 200,000 people. And a lot of these drugs are affecting maybe 20, 50,000 people, something like that. That means the cost is higher, but you can spread it over far fewer people, and that means the prices end up being a lot higher. People are facing those, and what has happened with the insurance companies, especially with AIDS patients, is several of them are increasing the copay, or in some cases you have to pay a percentage of the drug, of the most expensive drugs, and as a result it becomes very, very expensive for patients out there who are facing several $1,000s a month in drug bills, even though they have insurance. And it's done as a sort of a way. It controls costs, but it also works as a discouragement. If you're a sick patient with a lot of medical care and drug costs, it's a way of saying, don't come to us, go to our competitor over there. And you and I have talked about this. In a single-payer healthcare system, there's always ways they try to figure out to ration the care.
Right.
And this is sort of a subtle backdoor. We're not single-payer yet, but it's a subtle way to ration the care.
Well, and again, one of the reasons why you would have to ration care is certain individuals have expenses that are far greater than the average individual, and they take, especially by age and by infirmity, a disproportionate amount of scarce medical resources. And so whether it was Hillary Care in the old days or Obamacare now, they are all talking about this idea of rationing. So this is not something that's new. And of course, if you don't think rationing takes place, imagine if you've got some various medical issues and then you need to go on kidney dialysis. You begin to see that we already are starting to do some of that rationing anyway. But again, with pharmaceuticals, that's one of the explanations why some of these pills or some of these injectables are thousands of dollars.
Oh, some of them can be very expensive, and some of them can be very good. I mean, Sovaldi is a cure for hepatitis C. We didn't have a way to do that prior to that, but about 85-90% of the patients that take Sovaldi get hepatitis C, take Sovaldi, and they get a cure for it. So that's a huge benefit, but it's also a fairly expensive drug. Even though it's discounted to the insurers, it's much less than what you'll see in the paper when they talk about it being the $80,000 drug or something like that.
Sure.
But it's expensive stuff, and that's going to drive prices up for a while. The good news is Scott Gottlieb now is the new Food and Drug FDA administrator, and I think he's got some very good ideas about how to bring in competition and control the cost, not from the top down, but from the bottom up, and we've needed that for a long time.
One other one I just mentioned a minute ago in terms of one of the other P's is portability. We have our Wednesday roundtable. It's the Millennial Roundtable, and these millennials are going to have many more opportunities to work in so many different kinds of jobs. And the bottom line is if they leave one company and go to another company, it doesn't affect their car insurance, doesn't affect their house insurance, doesn't even affect their life insurance, but it does affect their health insurance.
Yes, it does.
And so portability is a big issue that, again, needs to be addressed in some way or another, doesn't it?
And Obamacare thought they were doing that by creating the health insurance exchanges.
Yes.
They thought a lot of employers would essentially put their people on the health insurance exchanges. They'd be able to shift from one plan to another, and there would be competition. Didn't work out like that. One of the things that the Cato Institute has proposed is what they call large HSAs.
Yes.
And the idea is the employer, instead of paying for your health insurance, takes that money and puts it into a tax-free health savings account where you can go and buy your own policy in the individual market. You might be able to buy into a group policy with the employer, or you could buy nothing with it. You'd still get to keep the money. But the idea is to let you make those decisions. I think you'd see a lot of young people buy their own policy that would travel with them from employer to employer so that they could stay with one insurer.
Well, and again, this is just sort of an artifact of history because my company doesn't own my car insurance, doesn't own my life insurance, doesn't own my house insurance, but it owns my medical insurance.
Right.
And that really just goes back to the end of World War II and then also a little bit later under the Nixon administration.
And it also has an effect on how insurers treat us, because we change jobs so often, and therefore we change insurers so often. Insurers don't have a lot of incentive to try to make sure you're living a healthy lifestyle, maintaining things, because they're probably going to lose you in a few years. So there's actually kind of incentive to minimize their spending, because you're going to be somebody else's problem likely in the near future.
Let's just, before we let you go, talk about what's available at IPI, because the Institute for Policy Innovation, just some great material. We have a link to your website. What can people find when they land there?
We've been around for 30 years now as a nonprofit, nonpartisan research institute. We've got a range of different things that we study, specialize in. I do health policy, welfare entitlements, and energy. We've got others who do communication and technology. Technology is a big issue these days. We do tax policy. That's a big issue, I'm hoping, in the next few months.
Let's hope so.
So we cover a number of the major public policy issues, and people are free to go there, IPI.org. All of our information is available, ready for people to read, consume, share, and whatever.
And I'm glad that you mentioned that, because I don't want people to think that all you do is healthcare policy, because we usually have you on there. I do quote from a lot of the technology stuff when you're not with us. But again, go to IPI.org. And Dr. Merrill Matthews, always great to have you in the studio.
Thank you so much.
We have covered quite a bit, but again, if you find yourself wanting some more, we have a couple of the articles by Dr. Merrill Matthews on our website, pointofview.net. Of course, you can follow him in everything from Forbes to Wall Street Journal and all the rest. But as we come to the winding down this particular hour, I wanted to, again, recognize that we're coming to the end of our fiscal year. So if you haven't had a chance to give to this ministry, we're really trying to help you sort through some of the information and misinformation, some of the clutter, and so that you could get some really good, helpful perspective on what is taking place. And right now, with this ongoing debate about health care and health insurance, we knew that you would want to know more about that. So again, that's why we've focused on that this hour. And we'll spend some time getting into some other issues in just a few minutes. But don't forget that as you go to the website, we have a Viewpoints commentary that I write every single day, and that's available to you. We have videos that we make available to you. We have our Take Action section. And as you give to this ministry, you're not just supporting the 2 hours of the program, but you're supporting some of the other media ministry that we have. And for your gift, we also want to make sure that you receive our Outlook magazine so that you can read more about some of these issues, all available at the website pointofview.net. Let me encourage you to go to that website, click on that button that says Give Now. Help bridge the great divide. Our nation is divided right now. If you don't think so, just look at the ongoing debate just about health care policy we just talked about, and you know that that is the case. And as you go there, you have an opportunity to not only give to this ministry, but as we mentioned, we have a matching challenge that doubles your gift. We have some suggested donation amounts, $75, $40, $100, $250, whatever you might want to, or write in an amount. And remember that because it is doubled, that means your gift of $100 becomes $200. A gift of $250 becomes $500. So please take the time to visit the website pointofview.net. And if you'd like to know a little bit more about becoming a member of the Truth Team, we have that pledge line number too, 800-347-5151. For a gift of $1 a day, $30 a month, $360 a year, you can support this ministry as well. 800-347-5151. We'll be back right after this.
There's a saying.
Hi, this is Kirby Anderson. You know, each day we take on the tough issues and provide a biblical perspective to them. The topics we cover are wide-ranging. Apologetics, theology, prophecy, creation and evolution, intelligent design, marriage, family, child-rearing, the millennial generation, trends in society, politics, economics, business, religious liberty, the Constitution, public policy, foreign policy, military policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View starts right now.
Across America, live. This is Point of View. And now, Kirby Anderson.
Thank you for joining me. We're spending some time today talking about money, and in some respects it fits very well with the fact that we're coming to the end of our fiscal year, which ends on Friday, June 30th, and we certainly do challenge you to consider what you might do to support this ministry. But when we talk about money, of course, we think of the great work of Crown Financial. Individuals that actually precede our guest include people like the late Larry Burkett and Howard Dayton, but of course now in just very able hands at Crown Financial Ministries is the CEO, Chuck Bentley, individual that of course has a background in business and literally travels the world speaking on these very important financial concepts. Going to look at a few of his blog posts that come from handwriting on the wall. And Chuck Bentley, we so value the work that you do, and thank you for joining us today here on Point of View.
Kirby, it's always my pleasure. How are you doing, friend?
I'm doing well. I hear you've just been traveling. Before we get into what you are doing in the United States, tell us which continents of the world you've been on over the last few weeks.
Well, the only ones I haven't been on this year are Antarctica, and I haven't been to Europe. The rest of them, I've been to some of them twice already, Kirby.
That's just amazing. So again, this is part of the work that you do with Crown Financial. And if nothing else, that helps you understand a little bit more that materialism and stewardship and all sorts of concepts we talk about here in North America, they have a little bit different look in other countries, but in some respects, some of the problems are routinely felt all over the world, aren't they?
Absolutely. Money is a universal language. All you have to do is take your thumb and first few fingers and rub them together, and everybody in the world knows what you're talking about, Kirby. People all have money problems. There's an upper class, middle class, and then, of course, the poor and ultra-poor in every part of society, and so it affects every single person on earth. So there's a great demand for what we teach, and especially among the body of Christ. We know there's a lot of biblical ignorance when it comes to what the Bible actually does say about money. And so we're trying to not only overcome that, where people know what the Bible says, but also to help them to apply those principles to alleviate pain and suffering.
Again, the link that we have on the website today, crown.org, and we'll talk more about that in just a minute. One of your recent blog posts was 2 steps to quit worrying about money. And the broader concept is this: we are not to worry about anything, but yet we do. And I can't imagine that there aren't a lot of listeners right now listening to this program, even as they've heard us talk about encouraging them to see what they might want to give to this ministry before the end of our fiscal year, who say, well, I'm just so worried about the end of the month, I can't even think about what I would give to you. So how do we deal with this concern that Jesus addresses in Matthew 6, and certainly seems to be something that we are still finding as a major issue that you have to address there at Crown Financial, even here in the 21st century?
Kirby, I think that when you look at Matthew 6, it's very fascinating to me because Jesus was addressing people who were worried about money. That was their worry. We know that the Bible tells us not to worry, but he was specifically addressing when they said to him, what are we going to eat? What are we going to wear? What are we going to drink? How are we going to get our basic needs met? This wasn't how are we going to pay the credit card bill this month, how are we going to fund our 401k, how are we going to have a comfortable retirement. These were really basic needs. And Jesus, when he responded, he either gave them some really bad financial advice or he gave them the perfect financial advice. And he said, I want you to stop worrying about those things. You've got your mind on things. You've got your mind on the material world. I want you to seek first the kingdom of God. And I like to say that we either are going to seek our kingdom, building a kingdom in this world, or we're going to seek building the kingdom in this world. And he was upending the worry. He was saying, you know, I take care of the birds of the air. I give all things their food. I'm the provider of all goodness, and you can trust me, but you're going to have to change what you're thinking about. So that worry comes about how we're going to be provided for. And in my blog post, I quoted the creditcard.com survey that said 65% of Americans are currently losing sleep over their financial condition. And, you know, Jesus is talking directly to those people. Stop losing sleep. The two steps are to recognize that God owns everything. He is our provider, and that he's going to take care of all of our needs. But he wants us to shift to think about his kingdom and his purposes more than our own. And that will get our minds off the fear and the anxiety.
You know, one of the other things you illustrate is, in addition to the 2/3 that say they're losing sleep because of their financial state, if you look at the millennials, and Chuck, one of the things we do every Wednesday is we have a millennial roundtable, and they found that 3/4 or 75% of millennials are worried about their ability to make student loan payments every month. So worry is even more intensely felt by the younger generation, isn't it?
Well, the millennials especially, they're suffering because they mortgage their education. Essentially, it is a mortgage. It's worse than a mortgage in some cases because there's no way to escape it. I talk to millennials all the time. I do some live interviews where people call and tell their horror stories about their student loan debt. And they do have a major challenge. There's a massive student loan bubble right now, Kirby, one that you address, one that we're trying to address. We're trying to help people not only to deal with it currently, but to tell parents to advise their children and grandchildren not to leverage their future on student loan debt. In very rare cases, is that a good idea? And so that's part of the biblical wisdom that we're trying to impart to God's people.
And again, you talk about this, Proverbs, for example, talks about the plans of the diligent lead to profit. And, of course, haste leads to poverty. So sometimes there are bad decisions that people make. You know, it looked like a good idea to buy that new couch. It looked like a good idea to buy that new car. It looked like a good idea to sell this house and move to another one. But sometimes hasty decisions bring us down. But also we just need to learn to trust in the Lord. And that's kind of the theme that you talk about in this blog post. Are we going to be motivated by money? Are we going to be motivated by our desire to trust in the Lord? And that is going to be at least a very good antidote to some of the worry that we might have about some of these financial issues.
No doubt about it. When we get hasty, when we get anxious, when we get caught up in something that we really, really want or think that we need, that's when we make the most mistakes. Larry Burkett used to say, and I can hear him saying this in my mind because we worked together for a number of years, he would say, you know, the guys are the ones that make all the big financial mistakes. The women make a lot of little ones, but the guys are the ones that will sink the ship. You know, it's got four-wheel drive, it's got camouflage, it's got something on it that a guy feels like he's got to have. It's a boat behind the pickup, and he'll go out and make a huge mistake. Where usually the gals, maybe they make mistakes, but usually they're small in nature. And I got a kick out of that because both of those are just being hasty. We've developed a system in our home to try to put a governor on that. And that governor is we'll wait sometimes 30 days or more before we buy something we really want. And we're asking ourselves, is it really necessary? And in 30 days, do I still want it that bad? And part of the reason we do that, Kirby, is not just because we like being thrifty. We like giving. We want to be in a position to give more, and so we make sacrificial decisions to be able to do that.
Continue our conversation with our good friend right after these important messages.
This is Viewpoints with Kerby Anderson.
You know, more and more social commentators are starting to write and express their deep concern about what has been happening on university campuses. Bernard Goldberg recently wrote about the cowards of academia. He welcomed the summer so that we don't have to hear from those sanctimonious liberal snowflakes that have taken over college campuses and prove that the lunatics have taken over the asylum. One asylum that got his attention was Evergreen State College in Washington State. They have what is called a day of absence, in which minority students leave the campus as a symbolic gesture. This year, they demanded that the white students and faculty leave instead. And one biology professor who disagreed with the idea had 50 liberal students disrupt his class and was forced to teach his class in a local park. Bernard Goldberg was shocked to hear how the school's president responded. Did he suspend or expel members of the mob? Did he at least issue a mealy-mouthed note of disapproval? No, he did not. Other commentators have also expressed their disbelief. New York Times columnist Frank Bruni writes, "The campus inquisitions must stop." He was shocked that the Evergreen president merely said, "You know, it's just the way discourse goes these days." Editors at the Seattle Times concluded that at Evergreen State College there was no safety, no learning, no future. Columnist Fareed Zakaria, speaking at the graduation ceremonies at Bucknell University, lamented the current state of education on many American campuses. He said American universities these days seem committed to every kind of diversity except intellectual diversity. Conservative voices and views, already a besieged minority, are being silenced entirely. You know the chaos on campus is reaching new levels when many of these progressive voices are now expressing their concerns about what is happening at many American universities. I'm Kerby Anderson, and that's my point of view.
For more information about issues covered on Viewpoints, visit pointofview.net. Pointofview.net.
You're listening to Point of View, your listener-supported source for truth.
Privileged to have with our good friend Chuck Bentley again of Crown Financial, and again we have some links to his website, crown.org, as well as to his blog, Handwriting on the Wall. And Chuck, you were asking just a minute ago, and I really didn't respond. I should have thought about this. One of the things we've been doing is moving our studio. I think last time we were with you, we talked about moving it, and I'll tell you, I don't want to do that again anytime soon because you finish Friday at 3 p.m., and you start again Monday at 1 p.m., and in that 69 hours, we had to move every piece of equipment, electronic and otherwise, and we made it, and we did it, but I don't recommend it for the faint-hearted. But that's one of the other reasons why during this time, as we get near the end of our fiscal year, we're asking people to consider a special donation just to help with some of the expenses. And of course, it's always good to end this fiscal year, which ends for us June 30th, in the black. So you know all about that as an individual that's been writing about finances and speaking about finances for decades.
Well, I do, Kerby. I also know how expensive it is to move, and we just went through one of those ourselves, so I can empathize with you. We also have a mid-year fiscal year end. I think it's important. Now, the biggest giving day in the United States is the last day of the year. You and I know all about that, being a part of a not-for-profit organization. I call it National End the Procrastination Day, where we have a fixed limit on when we can give and get the tax benefits, and so there's a lot of giving that day. But today is just as good a day as that day. In fact, every day is a good day to give. And I said this to you when we were together last there in the studio, that I think what you're doing is very important. Even listening to the commercial breaks and some of the things that you're bringing the body of Christ, making them aware of it, and the issues and the things that you're confronting with biblical truth. is a very vital and important work in today's culture. You know, Kirby, if we lose that, we actually are in danger of losing what Christ called our saltiness. Now, saltiness is a preservative. It not only gives zest and flavor, but it also preserves what is important. And Point of View is a preservative. And I am a very strong advocate that the airways are an efficient way to keep the truth of God's Word going out into this country, going out into the culture. You know, it's so efficient, and we don't know where those seeds are going to land. And I'm sure, Kirby, you could tell stories of people who've been impacted by the ministry of Point of View that, you know, you never dreamed were going to be reached. That happens to me all the time in radio, and I'm sure it happens to you. And as one radio host to another, as one leader of a not-for-profit to another, I can say to your audience that I wholeheartedly endorse what you guys are doing, and I encourage people to give, and to give generously to the work. This is an important work, and it's an important time of year to help the ministry.
Thank you so much. Let's again encourage you to find out a little bit more on the website there, pointofview.net. That will take you to crown.org. One of the other articles that I wanted to pull for sure is, does God want you to be rich? And the reason I wanted to do that, Chuck, as you well know, we're getting all sorts of different kind of mixed messages, and that was a response, I understand, from somebody who was sort of trying to figure that out. And so you've got everything from the prosperity gospel to the poverty gospel. You and I have talked about that before, but even since I've had you on the program, I've run into some others that are really kind of struggling with how to think about how I am to manage my financial resources, and is there a certain kind of lifestyle that God endorses that I need to be following?
I think those are great questions, and they're legitimate issues that the people of God wrestle with. We get very, very confused over that issue. I know I was, Kirby, and I was an adult and confused over this issue. I essentially had a scorecard coming out of business school that the amount of money that I made would indicate whether or not I was making a passing grade. And the more money I made, the more successful I felt in the eyes of the world, and in fact, in my own eyes. And I'd convinced myself that there was all a reasonable justification for pursuing money with, you know, all of my energy. And so I set out to do that. I didn't know what the Bible said about money. I would be considered a believer, a follower of Christ. I was a giver. I was engaged at church. But I'd never studied this topic, and I didn't realize it was so extensive. So the answer I like to give that brings balance to the issue is that the Bible clearly declares that the prosperity gospel is wrong. It is an extreme teaching. Unfortunately, it's infiltrated the church. It's infiltrated the body of Christ, not just in the United States, but all parts of the world, because it's a pretty easy message for the pastors to try to sell to the congregation. Typically, the pastor wants an opulent lifestyle. He wants to live as if he is rich, and so he justifies that and twists the Scripture and then tells everybody else they can be too. Now, unfortunately, he's the only one with a Learjet, usually. And we've got places in the world where I've traveled where the pastor literally has a Learjet, and the people's average income is about $300 a month in that country. You know, it's just abusive. It's horrible. But the other side of that equation is that the poverty gospel is also wrong. And the poverty gospel says that money is evil, and that I can't have anything or I'd be sinful, and that, going to work is a drudge, and I only give, out of this obligation to give, and that people who have money are bad. And in fact, you're seeing the secular humanist of the world declare somewhat of a poverty gospel in this country. You know, they're throwing stones at the 1%ers. They're saying that there needs to be equality, that there needs to be a common income across this country. We need a 90% taxation. Those are poverty gospel type of approaches, or at least a socialistic approach, and the Bible doesn't endorse that. So when I explain that, people always say, well, what's left? If it's not prosperity gospel and it's not poverty, what's left? And I like to say it's the middle ground. It's that God has entrusted to some 5 talents, some 2 talents, and some 1 talent. He has spread it out according to his desires, and we're all called to be faithful. The metric that we're measured by is not amount. It's not whether or not we're successful by acquiring how much is in our hand or our bank account, but it's what's in our heart. Are we faithful to God with what he's given us? And then we can all be faithful, whether we have a lot or a little, and we can stop judging each other. I believe the 10th commandment calls us to stop judging what other people have and determining that we should have it instead of them. The 10th commandment is the great equalizer. God said, don't pay attention to what other people have. Don't demand to have what they have. He set up a meritocracy, and he distributes his abundance unequally. But he also says that hard work will lead to a profit. But he doesn't leave us there, Kirby. He says we're to be generous first with whatever profits he's given us.
Chuck Bentley with us. We're going to take a break, and when we come back, I want to move a little bit from money into work, because there's so many great articles that he's written about things to consider when finding your dream job or ways to like your job more. And, of course, we also want to talk about their excellent program, Career Direct, so we'll get into some of that in the second half hour here. But just as we're going to a break, this is a time in which I really do encourage you to consider what you might do to support this ministry. Coming to the end of our fiscal year, and your gift equips not only you, but equips other individuals to begin to think biblically about every area of life, including their finances. And these are the kinds of things that we share here at Point of View, that are shared, of course, through Crown Financial, that you can share with your family around the dinner table, some things you can share with your coworkers, maybe a biblical perspective on issues. And, of course, also we recognize that these biblical principles about finance even apply to the economy, apply to politics, and all of the rest. So, again, we're trying to become, and I think we have become, your one-stop source for a perspective on the news, for how to bring a biblical perspective to some of those issues we talk about, as we've even talked about earlier in this week, how to defend a biblical worldview. And at a time when our culture and our country don't seem to be really moving towards biblical values, how much more important is it to support Crown Financial and Point of View and other good ministries that are really helping you think through these issues biblically? Again, because of the reach of this program, 1.44 million people, this is an opportunity for you to have a very significant impact. So we ask you to consider what you might do, even as we come to the break right now, to call our pledge line number. That's 800-347-5151, 800-347-5151. Of course, you can also go to the website, pointofview.net. As you go there, you'll see that there is an opportunity for you to give. And let me mention again that we have a matching fund. This matching challenge means that your gift of $100 becomes $200. We have a button there for $250. That would become $500. But if you can only give $50, that's great, because it becomes $100. Whatever you can do, we would greatly appreciate it. Go to the website, pointofview.net, or give us a call at 800-347-5151. We'll be right back.
There's a saying, if you fail to plan, you're planning to fail. Setting goals is something that every successful business and ministry does. Point of View is no exception, so please listen for just a minute here. This week, we're finalizing the budget for the coming year, including things that we hope to accomplish. Some plans are on the bubble right now. They're at risk. When the fiscal year ends Friday, we'll know whether we can do them or whether they'll likely have to wait. Point of View wants to bridge the great divide in America, cutting through the fake news that some are spinning, and also bringing you critical information that others aren't talking about. To do all we can in the coming year, partners like you need to step up now. Visit pointofview.net, click the banner Bridge the Great Divide, or call 1-800-347-5151. Whatever you give by Friday will be doubled up to $10,000. The hours are counting down. Please invest in a bridge of truth. Pointofview.net and 800-347-5151.
Point of View will continue after this.
You are listening to Point of View. The opinions expressed on Point of View do not necessarily reflect the views of the management or staff of this station. And now, here again is Kerby Anderson.
Continue our conversation today with Chuck Bentley. And again, we encourage you to go to the website, crown.org, or of course our website, pointofview.net, that provides the link. And in the first hour, Chuck, we spent some time talking about money. First half hour, I thought in this next half hour, we'd focus some of our time and attention on work. You've had some great pieces that you've written on 4 things to consider when finding your dream job, or 5 ways to like your job more, or what employers are really looking for. But before we get into some of those specifics, one of the things I always try to recommend to our listeners and even people that I meet, if they're trying to kind of figure out what God's will is for their life or how they're to use their gifts, I say, have you thought about going to crown.org and checking out the Career Direct Guidance System? Talk about that, because it has been so successful over the years in helping individuals understand what their gifts and talents might be, so that they really find a job that fits them much more effectively than maybe even the one they have right now.
Well, our founder, Larry Burkett, realized that our first stewardship was not money, but it was our talents. And so he worked with the University of Georgia and a team of psychologists to develop a psychometrically valid assessment that helped Christians understand how God made them. It's really a look inside at your unique design. I've used this on all of my children. I have 4 boys. We use it to give them career guidance and to make a good educational decision. But it's been used by hundreds of thousands of people around the world, Kerby, and now in 30 languages. But it's it's a simple assessment. It's 500 and something questions, but it simply categorizes what your true personality, how you respond to your environment, what you're interested in, what you're skilled at doing, and then it measures your values. And we put all that together, and we typically recommend using one of our coaches to help you discern sort of how all that fits together and to make a wise decision using the data. And what we have found, Kerby, is that our values are something that are typically omitted. We don't consider our values, especially when we look at a job, when we're talking about a good fit at work. Now, a company has values, and we have values, and if those are mismatched, then we're going to experience a lot of stress and frustration. I think it's one of the secrets to the success of Chick-fil-A. When people think about how they've become such a powerhouse in the industry of quick service fast food, it's because they're a company with values, and those values are easy to discern and to understand, and you can tell it when you walk in the stores. It's one of the reasons that I've so enjoyed having one of my sons work for them, because our values match their values. And it's the same with any place that you work. It's the same reason that people would listen to your program and support your ministry, is we have similar values. And so thank you for that endorsement. People can find it at crown.org. They can do the self-assessment, or they can request that they work with one of our trained consultants to understand their next step, either in education, if you're going off to college, or if you're just trying to make a career change right now.
Well, and again, let me just mention that as they go to the website, of course, they'll find Career Direct, but they'll also find all sorts of resources to help them with debt or budgeting or planning, saving. For our church leaders that are listening to this program right now, you have things for life groups. You have a money life study. You have a variety of other articles and resources in addition to Career Direct. So as people go there, there's just a wealth of resources so that people don't have to reinvent the wheel. The kind of work that Larry Burkett has done and you have done and Howard Dayton and all sorts of staff have done really help us to understand more about God's Word on money and finances and work. So I would encourage people to find all those great resources right there at crown.org.
Well, thank you very much, Kerby. That's what we're here for. We're here to help the body of Christ to thrive in this area of their life. It's an area where many people are experiencing pain. We know right now that 50% of Americans have less than $1,000 in savings, less than $1,000 that they could put their hands on in cash. Now, that doesn't mean they don't have money. It doesn't mean that they don't have a bank account or income or all those things. It means they just haven't set it aside. Part of the tragedy of that is we get into a lot of stress and bondage, and we're not able to fulfill all the things that God wants us to do with our life. And so we're trying to encourage the body of Christ to do the right things with their finances so that they can fulfill their purpose. We have to all be good stewards. We have to manage our resources wisely. We have to make decisions and be sacrificial. One of the things I'm learning is that the character of a steward is as important as the behavior. God talks about the character of a steward throughout the Scripture. And I think Matthew 5:5 is a key part of it, Kirby, that blessed are the meek, for they shall inherit the earth. The meek are the ones that have something in reserve. They're under control. They're constrained. It's like power constrained. And I'm sure you've got a good definition of it. But I like to say in finances, it's when you don't put everything on display.
Right.
Whatever God's entrusted to you, you can hold some in reserve. You're not living on the edge. You're not living on 110% of your income. You're living beneath your means. I just read a survey today. I was doing some work online about some research about health insurance, and they had a little blog post on this health insurance side of that 18% of Americans are living beyond their means right now. Only 49% are living on less than they earn. So that's a big number of people that we're trying to help to learn to do things differently.
Well, very good. So again, go to Crown and find out a little bit more. Chuck Bentley with us. Let's talk about work for just a minute for a couple of reasons. First of all, you've written quite a number of very good articles on that. We've talked about Career Direct, but also I recognize we've got a number of college graduates. I spoke at a commencement. I'm sure you've done some of those as well. You got all those fresh faces out there, and they're going out there to try to figure out what they're going to do with their credentials and their diploma. And you talk about 4 things to consider when finding your dream job. And some of those relate to this idea of Career Direct, that a career is a good fit with your skills, your interest, and your personality when all those find alignment. And so that's something that they should really spend some time thinking through. What am I good at? What do I do? What kind of hours do I work best at? What kind of environment do I work at? Those questions, if asked right now, will eliminate a lot of heartache in the future, won't they?
Absolutely. Today, even the logistics are becoming a big issue. You see a lot of millennials who prefer to either walk or ride their bike to their job. And so they're not only looking for a good company fit, they're looking for a good fit in regard to where they're going to live. That's why you see a lot of this urban loft development, so that young people sort of go back to the way it used to be, where they can stay out of their car and not get caught up in a commute. That's a big factor today, and it impacts the quality of your life. And if you're married, it'll impact how much time you're able to be home and be with your family. Also, every company has a certain environment. Some people have open offices, some have hard-walled offices, some are very modern, and some are traditional. And that makes a difference in how you feel about your work. So be sure that you understand the office environment. Obviously, compensation and your upward mobility is important to ask about in advance. And then what's their culture and the reputation of the company? Do they have a reputation for how they treat their people? Are they a company that has are known for their integrity? You know, as Christ followers, we want to be careful that we don't get into an environment where we're asked to compromise. That will cause enormous stress. I talk to people a lot about their jobs. They come to us, they want our advice, and we use the data through Career Direct. Then they want to know, where is God leading me? What does God have for me? And I always say that God may take you out of your comfort zone, but He's not going to take you out of your design. He designed you to be uniquely you, and He wants you to be who you are. Our job is to know who we are, go out into the marketplace, and be ourselves. It may be uncomfortable and may be stretched with more responsibility or more tasks that we need to do than we feel comfortable handling, but He typically keeps us within our design, Kirby.
Very good. Let's take a break. When we come back, I thought we'd just for a minute get a few tips on how to deal with some of those interviews. That is something that is probably one of the greatest stress producers in most people's lives. And again, I will encourage you to go to the website that we already have some links to look at 11 tips to nail your next interview, and also what employers are really looking for in some of that, because again, some of you will be going through interviews right now. If not, maybe you know somebody that will be, and we want to pass that on to them. And again, we'll also come back and talk about some of the resources that are available. For those of you in church leadership, let me just suggest that, again, there are church promotional resources. There's the Money Life Study, a Money Life Indicator, although also as an opportunity for you to maybe find some people that you know in your youth group and say, have you ever thought about taking this career direct assessment and really figuring out what you want to do before you spend a lot of money and time and resources beginning to get so far in debt with a student loan payment that you really are at the very end concluding that you really didn't spend your money or your time or resources wisely. So lots of great resources we'll talk about with Chuck Bentley right after these important messages.
Welcome to the First Liberty Briefing. I'm Jeremy Dice. $3.25 million. That's the price one New Jersey town will pay for its religious discrimination. Not long ago on this program, I told you about the refusal of Bernards Township, New Jersey, to grant a building permit to the Islamic Society of Basking Ridge, New Jersey. The society fought City Hall for at least 4 years, having their application denied 9 separate times. In November 2016, the U.S. Department of Justice filed a suit against the township alleging a violation of the Religious Land Use and Institutionalized Persons Act. The Department of Justice won just 2 months later. But by May 2017, the township decided to give up the fight, settle with the government, and allow the Islamic Society to build their mosque. This is good news for religious liberty. Though Bernards Township, in this case, used their zoning laws to prevent the building of a mosque, it could have just as easily been a synagogue, a church, a cathedral, or other house of worship. City governments cannot intentionally throw up permitting obstacles to religious organizations. They must treat a religious organization's application for land use just like it would any other land use application. In a land that values freedom, our government should never make the free exercise of religion difficult. To learn how First Liberty is protecting religious liberty for all Americans, visit firstliberty.org.
More people today are saying Americans don't really need religion, but America does need religion. Religion helps the economy, families, and even national security. Learn more by reading Saving America, 10 Reasons Religious Freedom is the Key to Our Nation's Future. You can download this free booklet at firstliberty.org/Saving America. That's firstliberty.org/Saving America. Discover 10 ways religion benefits America at firstliberty.org/Saving America.
Now, back to Point of View, your listener-supported source for truth.
Back for a few more minutes with Chuck Bentley, again, of Crown Financial. And Chuck, just before we run out of time, I did want to have you talk for just a minute about interviews, and you even have a section here, what employers really are looking for. What kind of tips would you give to some of our listeners who are going to be doing some interviews, going for some job interviews? Are there some things that they need to know?
Yeah, Kirby, I really like this blog post that we did called 11 Tips to Nail Your Next Interview, and I don't want to go through all 11 of them.
Sure.
But I can speak to it from an employer standpoint, and I know you could as well. I look for people who are passionate about what they're going to be doing. And it's not hard to show passion. I'm not talking about coming in and, giving the rah-rah and saying all the right things. but showing that you really have a sense of desire for that position. You've done your homework. You can ask some really informed questions, and it sets you apart from all the others. We've had interview processes. We do a team process here. We started with 100 applications. We now drilled it down to 10. We took out of those 10 3 group interviews. And the ones that demonstrated the most passion, the most interest, being the most informed were the ones that rose to the top. Because you want them to have a good fit. If it's a good fit for them, it's a good fit for the employer. And that's really what will set you apart in the interview. Now, I also know, Kirby, we don't have a lot of time before your year end is up. We're coming to the end of this hour, but your year end is coming up soon. And I just wanted to say that Ann and I have always supported Christian radio personally. It's sort of ironic because it was meant so much to us personally as listening to other programs. I go way back with Point of View. It's been a part of our lives for many, many years, and we've loved it and appreciated it and appreciated your leadership. You know, I'm in radio. We raise funds for our program to be on the air. But I think it's a privilege for people in the body of Christ to have a place where they can put their resources, where they can make an investment in the kingdom that's going to get such a great return on their investment. I look at it a little bit like a mutual fund. Lord, where can I put the resources you've entrusted to me that will bring the most glory for your kingdom, that will do the most good, that will equip your people to be strong in the midst of the challenges of our day? And you guys are right in the bullseye of that, Kirby. So I can say to your listeners, to your audience, you know, I wholeheartedly endorse the purpose of your ministry, the projects you're trying to accomplish, the need to give right here at mid-year as the fiscal year end comes to a close. And I hope I could encourage those who are on the fence to make that decision today, to actually do something about it, you know, not just to hear the call, but to go ahead and follow through and make that gift, especially with this matching challenge you have going. What a great opportunity.
Yes, very rarely do you have your investment doubled, and that's one of those things that we all enjoy. And again, I would also return the favor and say we have a link to Crown Financial, and there are ways you can give to that ministry as well. And while I'm talking about that, this is one other way that we like to equip people, Chuck, and that is I am becoming more and more aware as I travel around and meet some of our listeners that we have a lot of people that listen to this program that are in positions of leadership. Some of them are pastors, some of them are church leaders, some are deacons or elders, others are Bible fellowship leaders. I've even met a number of students that say, you know, I finished my seminary classes and I turn on radio to see what you guys are saying. So talk about some of those church resources, because up until now we've talked about a lot of the individual benefits like on debt and financing, but there are all sorts of programs that you have for churches. True?
Yeah, we do, Kirby. We have lots of resources for churches and lots that will equip the future leaders of the body of Christ. One of the things that we're looking at right now is that the average amount of giving in America right now among Christians is 2.6% of their gross annual income.
Wow.
Now, that amounts to billions of dollars of charitable giving. And it's a really big number, and it's an impressive number. And yes, we're very generous people as a culture, as a nation. But imagine if the body of Christ averaged 10%. You know, if we really stepped up to what I consider a biblical baseline for giving, which is just 1/10, that we would honor God with those resources, it would make an enormous difference. And so for leaders who are out there in the trenches, who are fighting these battles, we want to equip them to help them to multiply the number of stewards that they're overseeing, whether it's a church or a mission or an organization sending people around the world. If they will help raise up stewards, then the money will be available for the expansion of the Great Commission. The goal isn't to raise the money as much as it is to raise the steward, those who God has put in charge of his kingdom. He wants them to be stewards, as you are, and he wants those that we're leading to become stewards, because that's what we'll be for eternity. When we die and go to heaven, God is not going to put us in charge of heaven. He's going to continue to be the owner, and he's going to be the master, and he's going to give us tasks. In fact, in the parable of the talents, he said, I'll put you in charge of cities. You'll have a job in heaven, and it will be based upon your faithfulness as a steward. So we want to start now. We want people to become stewards and see that as their identity, as their eternal destiny, to manage resources for God's glory. And when that happens, the resources will be liberated. They will come forth. They will pour forth into the kingdom and into the worthy causes where God's being glorified and His people are being fed. And we want to accomplish that, and we want leaders to take up that cause. I push back against this idea that we have been raised up to help people get on a budget and out of debt and to put more savings in the bank. Yes, that's important, and it's an essential part of the practical nature of managing money. But if we leave out generosity, if we leave out the kingdom motive, then we're just creating more rich young rulers. And, the rich young ruler turned away from God, and we want people to come closer to God, to invite Him into their life, into their heart, into making a difference in their finances, so that they will one day hear, "Well done, good and faithful servant." Now, Kerby, if today somebody hears that and they make that shift from that we mindset, that what am I going to get out of this with my finances, to what am I going to be able to accomplish for the Lord, this has been a good day. This has been a great day.
Yes.
Somebody's eternal destiny.
Well, and again, I just love that stewardship message that you give. And again, you can find so much of it there at crown.org. And Chuck, thank you so much for partnering with us. Thank you for your kind words about Point of View, and we look forward to the next opportunity.
Kerby, I can honestly say as a brother in the Lord that we just love you. We love what you do. We love what you stand for. You're a beacon of light and hope. You're full of integrity. You're a great steward. What else can I say, Kerby? I just think that it's an honor and a privilege to partner with you. We do really, really appreciate the work that God's called you to do. You guys are on the leading edge every day, and we thank you for that work. And I just encourage those that are benefiting and want to spread this work to respond to this call to the matching gift today.
Well, again, thank you so much for those kind words. Again, crown.org, pointofview.net. Just before we run out of time, let me mention that we're coming to the end of our fiscal year. And as Chuck just mentioned a minute ago, if you've been thinking about being a good steward, and part of that is giving, we have so many times on this program talked about the fact that less than 10% give 10%. And so there is an opportunity for you to give today, and we really want to make that very easy for you. The pledge line is still open, 800-347-5151. Even though we're going off the air, we'll still answer those phone calls. And, of course, you can go to the website, pointofview.net. Because of the generosity of some donors, we've been able to match those funds, and we would encourage you to consider right now, even as we're going off the air, what you would do. You can go to the website, or you can call us, and we would love to take your pledge or your gift, and anything that you can do to help this ministry would be greatly appreciated. All of the material that we've talked about today is available on the website, and as you go there, I want to remind you that you're giving to more than just a 2-hour radio program, but all the videos we produce, all the links we produce, and just the opportunity to hear from so many articulate individuals, including Chuck Bentley, who is with us today. That's all we have for today. See you back here tomorrow.
There's a saying, if you fail to plan, you're planning to fail. Setting goals is something that every successful business and ministry does. Point of View is no exception, so please listen for just a minute here. This week, we're finalizing the budget for the coming year, including things that we hope to accomplish. Some plans are on the bubble right now. They're at risk. When the fiscal year ends Friday, we'll know whether we can do them or whether they'll likely have to wait. Point of View wants to bridge the great divide in America, cutting through the fake news that some are spinning, and also bringing you critical information that others aren't talking about. To do all we can in the coming year, partners like you need to step up now. Visit pointofview.net, click the banner Bridge the Great Divide, or call 1-800-347-5151. Whatever you give by Friday will be doubled up to $10,000. The hours are counting down. Please invest in a bridge of truth. Pointofview.net and 800-347-5151.
Point of View is produced by Point of View Ministries.